All right, let's talk about the Simulated Consultation Assessment, the SCA. This is an exam that's as much about strategy as it is about medicine, right? We're going to go way beyond just listing what's on the exam. I want to give you a real action plan, something that'll help you turn all that pre-exam stress into confident, solid performance on the day.
So what is the core challenge here? Honestly, it all boils down to this number, 12. You've got 12 simulated consultations, and for each one, you've got just 12 minutes on the clock. It's a real pressure cooker designed to test not just what you know, but how you actually perform when it really counts. So, how are we going to tackle this beast? Here's our game plan. We'll kick things off with a quick overview of the exam itself. Then we'll get into the nitty-gritty of setting up your space for success. After that, we're diving deep into the 3 biggest pitfalls that examiners see time and time again. We're talking data gathering, clinical management, and how you relate to your patients. And then we'll wrap it all up with a clear path to get you across that finish line.
Okay, first things first. You can't master the game if you don't know the rules, so let's just quickly break down the basic format of the exam.
You know, it's pretty interesting how they've set this up to be as objective as possible. You've got your 12 cases. For each one, you get a crucial 3 minutes to read the notes beforehand. They also mix it up with both video and audio-only calls, which is good practice. And remember this, there are no physical exams. The whole thing is recorded, but here's the part I think is really key. Each of your 12 consultations is graded by a completely different examiner. That design really helps keep the assessment fair and consistent for everyone.
Let's shift gears now and talk about the practical stuff. On exam day, your environment plays a huge role, and believe me, the rules are very specific.
The MRCGP is super strict about your room setup, so you really want to get this right. There are 3 main rules. First, 1 monitor only, unplug all the others. Second, if there's a landline phone in the room, it has to be completely disconnected, no interruptions. And third, any clinical posters, charts, anything on your walls, they have to come down or be completely covered up.
Now the good news is you're not going in there with absolutely nothing. You can bring some comfort items with you. Little things, like small snacks and drinks, simple meds like paracetamol and their blister pack, tissues, even a cushion for your chair. That's all fine. But here's a massive tech tip you cannot miss. You must use wired headphones and a wired microphone. They are crystal clear that Bluetooth is absolutely not permitted. Don't get caught out by that.
All right, let's get into the weeds. We're going to start with the first of the 3 big areas where candidates tend to slip up: data gathering. This is so important because, well, it's the foundation for absolutely everything else you do in that consultation.
And don't just take my word for it. This quote is direct feedback from the examiners, and it really hits the nail on the head. They're saying it's not about just firing off a million questions. It's about asking the right questions and digging deep enough to make a truly safe assessment. This is where a safe and successful consultation begins.
So, what does this actually look like in practice? What separates a pass from a fail here? Well, a failing consultation often feels kind of chaotic, with questions coming out of left field. A successful one feels logical. It has a flow, with really clear signposting. A strong candidate doesn't just ignore the patient's record, they weave that information into their questions. And critically, they don't just focus on the physical stuff, they are genuinely curious about the patient's life and how all of this is actually impacting them.
So how do you get better? First, cultivate genuine curiosity. That's what uncovers the little details that others miss. Next, make it a habit to systematically run through and rule out red flags for common issues. Use simple signposting phrases like, "Okay, I'd now like to ask you a few questions about." It guides the patient and makes you sound organized. And don't forget to summarize what you've heard. It shows you're listening and lets you check you're on the right track. And of course, the best way to improve is to practice with your peers.
Okay, so you've gathered all that data. Fantastic. But what you do next is just as crucial, and that brings us to the second major pitfall: clinical management. This is where your decision-making skills are really under the microscope.
Let's just cut right to the chase with a direct question. Is your prescribing completely aligned with current UK best practice? It sounds so simple, doesn't it? But a tiny deviation here, one outdated choice, can easily be the difference between a pass and a fail.
Just look at how specific these examples from the feedback are. For lower urinary tract symptoms, if your first instinct is finasteride, that's a red flag for the examiners. Best practice is to start with tamsulosin. For a patient with COPD, it's not enough to just prescribe an inhaler. You have to be talking about the bigger picture: pulmonary rehab, smoking cessation. And when you have a patient with multiple health issues, you absolutely cannot ignore polypharmacy. You have to adjust your entire plan for everything they've got going on.
And it goes beyond just prescribing.
A really common mistake is making referrals that aren't quite aligned with guidelines, whereas the stronger candidates, they stick to nice and sign like glue. To pass, you've got to be proactive about managing risk, and you have to give very specific, tailored safety netting advice, not just a generic, come back if you feel worse.
Okay, so what are the habits you need to build? First, make it second nature to check the BNF and national guidelines. Actively seek out patients with multiple conditions to manage in your regular practice. Talk through risk management strategies with your supervisor. And really work on your safety netting. It needs to be specific to that patient, and it should be reassuring, not just a scary list of everything that could possibly go wrong.
And now for our final key area. And honestly, this is the one that ties everything together, relating to others. This isn't just about being nice. It's about genuine, person-centered communication.
This quote from an examiner is just so powerful. It perfectly shows how easy it is to slip into medical jargon without even realizing it. We might say, there's a small lesion on your film, and think we're being clear. But for a patient, that phrase could mean absolutely nothing, or it could be utterly terrifying. Clarity is everything. The difference here is night and day. A weak consultation can feel scripted, almost robotic. A strong one is all about active listening, picking up on cues, and actually responding to what the patient is saying. It's about being sensitive and respectful, never judgmental, and it means dropping the jargon and using simple, clear language that actually connects with the human being in front of you.
So how do you work on this? Well, you have to practice active listening. That means not just waiting for your turn to talk. Before you explain something, just pause and ask yourself, what is the single most important thing this person needs to understand right now? And then just say that, as simply as possible. And here's a huge one people forget. Always check for understanding. A simple, does that make sense, can make all the difference. And finally, just be a sponge. Watch your senior colleagues, see how they build rapport and explain complex ideas. It's invaluable.
Okay, we spent a lot of time on the pitfalls and what can go wrong. But let's flip that on its head now. Let's talk about the path forward. How do you take all of this and turn it into a clear path?
And look, if you find yourself in a position where you have to resit, the first rule is do not panic. Instead, get strategic. First, take a deep breath and really dig into your feedback. Use the official MRCGP notes to understand what it's telling you. Then, sit down with your trainer and make a targeted, specific plan that focuses on those weak spots. And only rebook the exam once you've had time to really work on that plan and feel your confidence grow. The most important thing to remember here is that you are not in this alone. The MRCGP actually has a ton of great resources to help you out. The official SCA Consultation Toolkit is an excellent place to start. There are also webinars and courses you can sign up for. Definitely get a study group going with your peers for role-playing. And use your supervisor. Ask him to do things like random case analyses to really sharpen your clinical thinking.
So let's leave it here. Mastering the SCA is a real challenge. There's no doubt about it. But it is absolutely achievable if you approach it strategically. It's about understanding the rules of the game, being honest about your own weaknesses, and then using every tool available to turn those weaknesses into your greatest strength. So the final question I want to leave you with isn't just will you pass, it's how will you prepare to truly excel?